Hi, my name is Eli. I'm a nurse practitioner student. I'm going to perform a head to toe exam. Can you tell me your name and date of birth?
Tim Alamong, 22087,
Very good. And where are we?
Brooklyn,
And what year is it?
2026.
Who is the president of the
Trump.
Trump. So the patient is alert and oriented to person, place, and time. His speech is intact, no dysarthria, no slurring noted. So now I wash my hands. The patient is draped. I put my gloves on. I'm gonna go ahead and start with measuring the blood pressure. I'm gonna tell you a few words that I want you to remember. I want you to repeat them after me. Cat, chair, salad.
Cat, chair, salad.
I want you to remember those words because I'm going to ask you in a minute. Okay, I'm going to start by putting the cuff on the patient. Make sure the cuff is inflated. Then I locate the brachial artery and I put my my stethoscope on the artery. Okay. Now I inflate the cuff. And now I start deflating it, waiting for the first pulsation. And then waiting till the last pulsation. The patient blood pressure is 128/76, which is normal. I'm going to go ahead and remove the cuff. And I'm going to go ahead and palpate the pulses. I'm going to start with, can you tell me the three words I told you?
Cat, chair, salad.
Very good. And what year were you married?
2019.
19. So I'm going to go ahead and palpate the patient. The recent and the remote memory is intact. So I'm going to go ahead and start with the pulses. I'm doing the temporal pulses and carotid pulses one at a time, and brachial pulses, radial pulses, and popliteal pulses, and femoral pulses, without forgetting those ones. And dorsalis pedis pulses, and posterior tibial pulses. And I'm also inspecting the skin and checking the skin targus and the capillary refill in the hands as well. Okay, the patient pulses are 2+, which is normal, and the skin is intact and it's warm to the touch, it's smooth. There are no masses, there are no scars, no lesions, and there are no moles noted. I was also inspecting for any signs of cyanosis in the lower, and in the upper extremities. No signs of cyanosis, and no clubbings in the fingers, and that is normal. So now I'm gonna go ahead and move to the head. I'm inspecting the scar. The scar is normocephalic, a traumatic. The contour is smooth and round. I'm going to go ahead and palpate the hair and the scalp. Tell me if you feel any pain or any tenderness.
No.
No pain or no tenderness. So no pain, no tenderness, no scales, no lesions, no scars, no masses palpated. The hair is equally distributed, no falling hair, no signs of alopecia. So now I'm gonna go down to the face. The face is symmetric. I don't see any scars, no lesions, no masses, no edema, no hirsutism. I'm going down to the eyes. I'm starting by inspecting the eyebrows. The eyebrows are symmetric and the hair is equally distributed. The medial and lateral canthus are symmetric, and the eyes are centrally located in the sockets. I don't see any excessive tears or dryness, which would point to the problem to the abnormality of lacrimal glands. So I'm going to go ahead and inspect the eyes by lifting the eyelids and pulling down the conjunctiva and looking into the eyes. I'm going to go to the left eye as well. The conjunctiva is pink and moist, no exudates. The sclera is white, no signs of jaundice. The iris is brown and no corneal lacellation or opacity. So I'm going to check the pupils, the size of pupils. I'm going to check the shine the light in both pupils. The pupils are 3 millimeters. They are symmetric, they are equal round, they react to light and they accommodate. I'm gonna go ahead and check for direct light reflex and the consensual light reflex. Shining the light in the left eye, both pupils constrict, direct light reflex in the left eye, consensual light reflex in the right eye. Shining in the right eye, both pupils constrict, direct light reflex in the right eye, consensual light reflex in the left eye. So now I want you to look at that wall. The pupils are dilated. Now I want you to look at this pen. Very good. The pupils constrict and they converge. That was to test for convergence and accommodation, and that is intact as well. I am going to go ahead and dim the light and check the fundoscopic, do the fundoscopic exam. This real quick, just 1 second. Very good. The light is dimmed. Approaching the patient from about 14 inches with my left eye to his left eye. I am seeing the red light reflex is there. I'm inspecting the other structures of the eye. Very good. I'm going to approach the right eye with my right eye as well from about 14 inches. The red light reflex is present. I'm inspecting the other structures of the eyes. Very good. I'm going to turn on the lights. The red light reflex is present bilaterally. There is no nicking, no crossing, no swelling, and no bleeding from the retinal vessels. The optic disc is round and pink, and the disc to the cap to disc ratio is the cap to disc ratio is 0.4, which is normal, and there are no macular lesions, and those findings are bilateral. Do you wear any glasses at all?
No.
Okay, from about 14 inches, I'm going to perform the Rosenberg eye exam. I'm going to ask you to cover your right eye and read the last line for me.
LTFPH.
Very good. Now I want you to cover the left eye and read it backward.
HPFTL.
Very good. The patient vision is 20/20, which is normal and expected, and that means the cranial nerve 2 is intact. So I'm going to move down to the nose. I'm going to start by palpating the nose. Tell me if you feel any pain or any tenderness.
No.
No pain or tenderness. The maxillary sinuses, any pain or any tenderness?
No.
And the frontal sinuses, any pain or any tenderness?
No.
Very good. So I'm going to close the one nostril and ask you to breathe in and out. And the other one. Very good. The nails are patent, and now I am going to go ahead and ask you to close your eyes for me and tell me what you smell.
Steak.
And I am going to close this and tell me what you smell.
Caesar salad.
Very good. The patient smell is intact, and that means the cranial nerve 1 is intact. So now I am going to go ahead and look into the nose. You can tilt your nose back a little. I'm looking at the nose. Very good. I'm gonna look into the right nose as well. Very good. The septum is a midline, no perforation, no scars, and the mucosa is pink. And the mucosa is pink, no lesions, no drainage, and no exudates, and no polyps noted in both nostrils, and that's normal. So now I am gonna go down to the mouth, inspecting the lips. The lips are symmetric and they are pink, no scars, no lesions. And now I'm gonna ask you to give me a big smile, please. And now can you puff your teeth, your cheeks? Very good. That means the cranial nerve 7 is intact. So now I am going to go ahead and ask you to stick out your tongue for me. Move it left and right. Very good. That means the cranial nerve 12 is intact. So I'm gonna go ahead and ask you to say ah. 1 second. Let me look into that. Okay, I checked the uvula was raising and the soft part was raising as well, and that means cranial nerve 9 and 10. The motor component for cranial nerve 9 and 10 is intact. So I'm gonna do it again. Say ah. Very good. I am inspecting the mouth, the mucosa. The mucosa, the tongue, under the tongue, the soft and hard part, and the tonsils are pink and moist, which is normal. And there's no bleeding gum, no missing teeth, no lesions on the tongue, no exudates from the tonsils. The tonsils are 2+, which is normal as well. I'm gonna move on to the ears. I'm going to ask you to close your left ear and tell me, cover your left ear and tell me when you hear me rubbing my fingers.
I hear it.
Good. I'm going to ask you to cover your right ear and tell me when you hear me rubbing my fingers.
I hear it.
Very good. That means gross hearing is intact and cranial nerve 8 is intact. I'm going to go ahead and perform Weber test. You can tell me when, if you hear in one or both ears. You can say one or both.
Both.
Very good. That means bone conduction is intact. So now I'm going to perform a rhyme test by putting this on the mastoid process, and you can tell me when you stop hearing it.
Oh, stop.
Okay. Okay, tell me.
It stopped.
Very good. I'm gonna go to the left one as well. Tell me if you stop hearing it.
It stopped. It stopped.
Very good. That means that the conduction hearing is greater than the air conduction hearing is greater than bone conduction, which is normal. I am inspecting the auricles. The auricles are symmetric, and I'm going to go ahead and palpate the mastoid process. Tell me if you feel any pain or any tenderness.
No.
Okay, I'm going to ask you to clench your teeth for me. Very good. You can pretend to chew something. Okay, cranial nerve 5 is intact, and now I am going to palpate the torgus. Any pain or any tenderness?
No.
Okay, I'm gonna look into the ear, starting with the left ear. I'm gonna pull the auricle up and back and look into the ear. I'm gonna go to the left one, and I pull the auricle up and back as well. Very good. I checked all the structures of the ears in both ears, and the tympanic membrane is pearl gray. No signs of perforation, no scars, and no bulging, no excessive cerumen from the ears, no exudates, no lesions noted. The malleus and paraphracida are intact, and all the structures are intact. So now I'm going to move down to the neck, and I'm going to palpate for the lymph nodes. I'm going to start with preauricular, postauricular, occipital, superficial cervical chain, deep cervical chains, and posterior cervical chains, supraclavicular chains, and these are submandibular lymph nodes and submental lymph nodes. Any pain or any tenderness where I touch?
No.
No pain, no tenderness. So I'm gonna go ahead and go to the chest. I'm going to ask you to turn this way, and I am going to expose the posterior chest. Let me see if I can see you. The posterior chest, and leaving the anterior chest covered for modesty. Let's move this. Can you get it up? Okay, that's good. Okay, that works now. Okay, I am inspecting the posterior chest. It is symmetric. I see no masses. I see no lesion or any scars. I'm going to palpate for any pain or any tenderness.
No.
No pain, no tenderness. So now I'm going to palpate for tactile parameters. Every time you feel my hands, you should say 99, okay?
99, 99, 99, 99, 99.
Tactile parameters is present, and it's normal. So now I am going to percuss all the lung fields. I hear resonance on all lung fields and some dullness when I get to the organs. So now I am going to auscultate and checking for egophony. Every time you feel my stethoscope, you say E.
E.
Very good.
E. 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 E.
Very good. I hear E sound, no A sound is heard, and that is normal. The next thing I'm going to do, I am going to listen, and this time I want you to whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Very good. The sound is muffled, which is normal. And now I am going to check to percuss for the for diaphragmic excursion. I am going to. I'm going to ask you to take a deep breath and exhale and hold it, okay? I feel dullness here. I mark the spot. I can see it. And now you can breathe. Now I'm going to ask you to take a deep breath and hold it. You can breathe now. The area is about 5 centimeters, and that is the diaphragm, and that is normal. So now I am going to check the AP diameter as well. The AP diameter is 0 to 1, which is normal. I am going to expose the anterior chest and leaving the posterior chest wall covered for modesty. And this. This time I'm gonna ask you to turn back this way. Very good. And I am going to palpate for any pain, any tenderness.
No.
No pain, no tenderness. Very good. I'm gonna percuss all the areas, all lung areas, lung fields. Very good. There is a resonance on all lung fields, and now I am going to go ahead and auscultate for lung sounds as well. You take a deep breath when you feel my stethoscope. Deep breath, in and out, 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 in and out. Very good. All lung fields are clear. No crackers and no crackers and there are no crackers and there's no wheezing felt. So this time I am going to move on to the cardiac assessment, and I am going to auscultate all the areas, starting with the aortic area, which is located at the second intercostal space at the right. You can sit up without leaning backward. At the right second intercostal space at the right sternal border. Pulmonic area at the second intercostal space at the left sternal border. Orbs point at the left at the third intercostal space at the left sternal border, and tricuspid area at the fourth intercostal space, left sternal border, and mitral area at the fifth intercostal space at the left midclavicular line. I'm gonna do that with the bell as well. The same areas. I hear S1, S2, which is normal, no extra sounds, no murmurs, and no murmurs or gallops felt. So I'm going to ask you to lean forward. I am going to listen to the mitral area again with the diaphragm and the bell. Okay, and the bell now. Very good. That is good. I'm going to ask you to lie down. Again, the sounds are normal. I am going to palpate those areas for any heaves or any throws. I'm going to start by asking you to turn your head on the other side. I'm looking for any pulsation for the jugular vein or the carotid artery. There is no jugular vein distension, but there is carotid artery pulsation, which is seen, and that is normal. So now I am going. You can turn your head back and be fine. I'm going to palpate for the carotid artery as well, one at a time. Very good. I'm going to listen for any bruise. We're using the bell of my stethoscope. There are no bruise. So now I'm gonna go ahead and palpate the same areas that I was listening to, the aortic area, pulmonic area, Erb's point, any pain or any tenderness.
No.
And the tricuspid area and the mitral area, there are no heaves, no throws. I'm gonna go ahead and listen to those areas with the diaphragm of my stethoscope as well. Now I'm gonna do it with the bell. Very good. So now I'm gonna move on to the abdominal assessment, and I am going again to expose the abdomen, and I am inspecting the abdomen. The abdomen is flat, non-distended, no pulsating masses, no lesions are noted. So now I am going to go ahead and listen to the vowel sounds, starting with the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. And the vowel sounds are heard, no hypoactive or hyperactive sounds. So I'm going to go ahead and percuss the abdomen as well, starting the same order. Um, right lower quadrant, left right upper quadrant, left upper quadrant, and left lower quadrant. I hear timpani, which is normal. So now I'm going to go ahead and percuss it for the liver. I'm going to start with the chest, where we hear resonance. I hear dullness here. I mark the spot. Now I'm going to start with the lower quadrant going upward, where we hear timpani. Then I hear dullness, and this is 8 centimeters, which is normal, which means there's no hepatomegaly. So I'm gonna move on and check the splenic percussion sign, looking for splenomegaly. Okay, I hear timpani on all areas. The spleen is actually cannot percuss the spleen, which is normal. There is no splenomegaly. So now I'm gonna go ahead and palpate. Starting with light palpation again. Any pain or any tenderness?
No.
No pain, no tenderness. Any pain or any tenderness?
No.
I'm gonna do deep palpation. Any pain?
No.
Any tenderness?
No.
No pain, no tenderness, no mass is felt. I'm going to palpate for inguinal areas. Tell me if you feel any pain or any tenderness.
No.
No pain, no tenderness. So I'm going to ask you to sit up because I'm done with the abdomen. I am going to perform a corticovertebral angle tenderness. I am going to check for this area. The punch test. Any pain?
No.
No pain, no tenderness, and that is normal. So now I am going to move on to the musculoskeletal exam, and I am going to start by palpating the temporomandibular joint right here. I'm going to ask you to open and close your mouth. Very good. Very good. The temporomandibular joint range of motion is intact. I'm going to go down to the neck. I'm going to ask you to push against my head. Very good. Push against my head. Very good. The muscle strength of the neck is 5, and that is intact. And now I am going to ask you to bend your neck like this and backward, and try to turn left and right. Very good. Now try to touch your ear with that one and with that one. Very good. The muscle strength of the neck is intact, and the range of motion of the neck is intact. I'm moving down to the shoulders. Tell me if you feel any pain or any tenderness.
No.
No pain, no tenderness. Now you can shrug your shoulders for me. Very good. And that means the muscle strength of the shoulder is intact. And actually, I was also testing for cranial nerve 10, and the cranial nerve 10 is intact as the patient is able to shrug the shoulders. We are going to do the shoulder extension. I'm going to ask you to do this all the way. Very good. And then all the way back. That is the extension. This was the flexion, and this is the extension. Okay, I want you to hug yourself as tight as you can. That is internal rotation, and then backward. Okay, that is external rotation, and I'm going to ask you to do this. This is abduction, and now you can bring it back. That is adduction. Bring me all the way back for me, please. That is adduction, and that means the range of motion of the shoulders is intact as well. I am going down to the elbows. I'm going to start by palpating the medial epicondyle and the lateral epicondyle, the acromion process. Medial epicondyle, lateral epicondyle, any pain or any tenderness when touching? No. Okay, you can extend this. That is the extension of the elbows, like this, like this. I want you to bend backward. That is the flexion of the elbow. Now I want you to pull against my hand, push against my hand. Very good. I'm gonna go down to the wrist. I want you to do like this. That is the supination of the wrist, like this. That is the pronation of the wrist. And now I want you to move it in like this, like that. Very good. Any pain or any tenderness?
No.
Any pain or any tenderness?
No.
You need to like this. And now you can bring it back. Very good. Any pain or any tenderness? And these are the medial carpal joints and metacarpal joints and lateral phalangeal joints. So medial carpal phalangeal joints and medial. These any pain or any tenderness?
No.
Okay. No pain or any tenderness in the proximal carpal joints or medial metacarpal joints or the distal carpal phalanges actually. So now I am going to ask you to form a fist. And now open, that was flexion, now this is extension, and now I want you to spread them apart. Don't let me push them in. Good. So the muscle strength of the upper extremities is the 5, which is normal, and the range of motions of all upper extremities is normal. So now I'm going to ask you to lie down again, because I'm going to go to the hip. Okay. I'm going to start by popping any pain or any tenderness.
No.
Okay. I am going to flex the hip. The hip is flexible, it is flexing. Okay. I'm going to do the medial rotation of the hip and then the lateral rotation of the hip. I want you to lie on the left side. I'm going to look for extension of the hip. I'm going to pull it all the way up, back. Very good. So the hip range of motion is intact, and now I'm gonna go down to the knee. Any pain or any tenderness?
No.
No pain or any tenderness. I'm gonna go ahead and flex the knee, and I'm gonna go ahead and extend the knee. Okay. The range of motion of the knees is intact. I can do it on both legs if I want, but I'm gonna do in this one is intact. So I'm gonna go down and go to the leg. I want you to push down on my hand. Very good. Now you can push up. Very good. So now I'm gonna go to the ankle. Any pain or any tenderness?
No.
No pain or tenderness. How about there? Any pain or any tenderness?
No.
You can now flex your toes. Flex. Very good. Okay, you can now flex this leg. I'm gonna do it. Relax, relax for me, relax for me. That is dorsiflexion. That is plantar flexion. This is eversion and inversion. And the range of motion of all lower extremities is intact, and the muscle strength of the lower extremity is intact as well. I'm gonna push this. I can ask you to sit up again. I am going to now ask you to close your eyes, and I am going to ask you if you can feel anything touching you. You can say now when you feel it.
I feel it.
Good?
I feel it.
Very good. That was light touch. Now I'm going to keep your eyes closed. I am going to show you a few things. This is dull, and this is sharp, right?
Mm-hmm. Yes.
Dull, sharp, and this is vibration. Okay, now I'm going to ask you, tell me what do you feel. You can say dull, sharp, or vibration.
Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Vibrate. Vibrate. Dull. Sharp.
Very good. The sensory, the patient's senses are intact, so now I'm going to go ahead and perform a deep tendon reflex. I'm going to start with the biceps, and here it is. And I'm going to go to the triceps. You can relax your arm as well. Relax it, relax it. And now, he's kicking me. Now I'm going to do the brachioradialis. Relax, right? And I'm gonna go for the patella, and I'm going for the Achilles tendon. Very good. The patient deep tendon reflexes are intact. So now I am going to ask you to take one of your feet and the heel and bring it down on this side. Yeah, that was the shin, heel to shin, and that is intact. So now I'm going to ask you to stand up and walk there for me. You can walk there. Very good. The patient gait is intact. You can walk backward with your foot and in front of you to the toes. That was the heel to toes walk, which is intact. I'm going to ask you to close your eyes for me. Okay, you stand there closing your eyes. Very good. The patient is not swaying sideways. That is good. And now I am going to ask you to keep your hands, your arms like that, extended, with your eyes closed, please. There is no arm drift, and now you can open your eyes. I want you to touch my finger with the, touch my finger and then touch your nose, okay? Finger, the nose, touch your finger, touch the nose, okay? See if you can stand like this so anybody can see you. Touch your finger, my finger, and the nose. Good. Very good. What else? I think that is the end of our exam, and thank you so much. Okay, you can have a seat.